So far, the NHS has coped with COVID-19, but there is still no vaccine, and there are fears that unless we prepare now, a second wave in the winter could be even worse. At this GP surgery in South London, they're now trying to clear the backlog of routine appointments that were put on hold. But doctors here are worried about the winter.
As much as you do and as much as you prevent, you are still going to be in a situation this winter coming that you are in the post-COVID winter, and it's still going to be a big strain on staff, especially staff that have already been working, above and beyond what they normally would work in the NHS. They're already tired, and having a second wave is really going to put pressure on them.
Today's report says in order to prepare for a new wave of infections, there must be adequate PPE and COVID-free zones in hospitals and care homes, increased capacity of test and trace, flu vaccines for healthcare workers and those at risk, and a public information campaign for all.
We're heading, I'm afraid, for a perfect storm unless something dramatic changes in being prepared for this. We've got influenza, which obviously comes in the winter months. We've got cold weather, which makes the coronavirus live longer. Add to that the NHS build-up of chronic and surgical cases that we've been accumulating these last 4 months, and we've got a real problem on our hands.
Author Jan Cavell has a lung condition, which means she's still shielding at home. Another spike in COVID cases means that will continue.
It's really tough. It's never ending, speaking to people in the pharma industry, there is no light in sight, really. Vaccinations usually take 10 years. Is that going to be the rest of my life? That's a scary thought.
Scientists say if there is a second wave, there could be up to 120,000 deaths this winter. But by taking action now, many lives can be saved.